Excellent. We're here at the inflatable brain. So tell me about what area of the brain you like to talk about.
Sure. So actually here we're at the back of the brain. This is the occipital lobe. It's the very, very back portion of the brain. And that's the main area of the brain that controls vision and controls what you're seeing. So if people have seizures, focal seizures coming from there, it can be very different than other seizures, especially when it starts. There are two main types of seizures that are coming there, two main seizure syndromes that may come from there. One often starts with visual changes, and the difference about seizures versus something like hallucinations that people may have in psychosis or something like that, schizophrenia, is you won't see clear formed visual changes. So you won't see a person, you won't see someone speaking to you or anything like that. It's more of a kind of shadow, a change in your vision, colors, or darkness.
Okay.
The other interesting thing is those are the seizures that are often associated with headaches, pretty severe headaches associated with that. And then there's another seizure type called Paniatopolis syndrome, and that's actually associated with ictal vomiting, so vomiting during the seizure. And it can be very, very severe vomiting. Some people may have vomiting after a seizure from other areas, but this actual specific type of seizure, the vomiting is part of the seizure.
Yeah, I talked about that. That's kind of one of the things which happens to me as a person with epilepsy.
Oh, okay.
So yeah, so I can relate to that personally. Tell me more about your background and how you got into neurology, because I think that's also interesting as well.
Oh, sure. So I did my original training on the East Coast with Dr. Nico Moshe at Albert Einstein. And I met my wife there. My wife also has epilepsy. She has juvenile myoclonic epilepsy. And just seeing the things that she was going through and a lot of the struggles she was having. We did a lot of work with the Epilepsy Foundation. It was just a population and the type of neurological disease I was really interested in, and a community that really needed help and needed people to be working in the community. So she probably influenced me a little bit to subspecialize in epilepsy. I came out to UCLA, I think it's been 12 years now. Did my fellowship training, and I've stayed there ever since. And now, just this past year, actually only a couple months ago, we opened up a new center. It's the Adolescent Epilepsy Center at UCLA. It's a multidisciplinary center where we have epileptologists, nurse practitioners, social workers, dietitians, psychiatrists, psychologists, and occupational therapists all in clinic together. So it's a true multidisciplinary center, and we evaluate adolescent patients and really kind of look at the patient kind of as a whole, not just focusing on the seizures. While that's important, we know that a lot of the other things associated with seizures, epilepsy isn't just seizures, so things like depression, anxiety, learning disabilities, they're just as important, if not sometimes more important, and we're really focusing on that so we can help those aspects, and that really influences and really can make a huge difference on quality of life.
And so you've built this and recently launched this fab epilepsy center, and you say it's for adolescents, teenagers, and young adults as well.
Yes.
So you do a gamut of tests. You do genetic testing as well. Is that included?
Yeah, so it's like a regular epilepsy visit. So we do things like imaging, EEGs, telemetry, genetic testing. That's really the epileptologist's role. And then kind of the social worker comes in and sees what other kind of support services are needed. Psychologists may come in and find out, what if there are any depression. Psychiatrists may come in and talk about ADHD and prescribe medications for that. And then our occupational therapist is focusing on one of the really important things, I think, that is going on in the epilepsy world today is transition. And so we see patients from about 12 to 20, and we're starting a kind of a transition program. So even as early as 12, talking about that, because patients need to eventually be transitioned to adult doctors, and it can be a very difficult process. It's hard. I mean, after you've been seeing a doctor for so many years, all of a sudden they're, oh, now you have to go find a new doctor, a new team. So our goal is to really ease that transition, and by using all the different specialties, kind of really get the patient in the best shape they can be, and with the most knowledge we can give them, so that they're comfortable with their own illness, and they're comfortable treating and understanding everything that's going on, so that they can transition more easily into adult care.
That's really great. What else can you tell us about the brain as we're here on this side?
So let's see, over here on the left side, so coming from the occipital lobe moving forward, temporal lobe on the left side typically is where language is, especially for people who are right-handed. When we do surgery, temporal lobe is a big location to do surgery. On the left side, we need to do probably additional testing, extra testing, things like functional MRI, MEG scan, even a WADA study, which puts half the brain to sleep to see where helps see where language and memory are. Because we need to, and also mapping the brain itself during surgery, because we need to know exactly where language is if we're going to do surgery, because we want to avoid affecting language, and we may be able to do something where do partial surgery, and then one of the new devices to put on the brain itself to help treat the seizures as well with the surgery.
Okay, so is there anything else that viewers should know about epilepsy and their treatments? Is there something that they should know right now?
I think the most important thing, and the thing I really want to get out to everyone, is that epilepsy is not just seizures, and that's the comorbidities, which are other things associated with it, like the depression, anxiety, ADHD, learning disabilities, even sleep disorders, autism. It's all of those things that are just as important as treating the seizures, and we need a team to do that. And that's how we're going to give everyone the best life possible and best quality of life possible.
And finally, let's talk about Epilepsy Awareness Day. Why should people attend here?
It's a great event. If you just look around, there's so many different booths talking about so many different things, different treatments, different epilepsy centers. I know there's a whole section about the dogs that are associated, the healthcare dogs. And so there's just a wealth of information in a small area. And I think you can get more information, more education here in an hour than you can in doing any other things, doing reading or anything like that. I just think it's probably one of the best education opportunities that anyone could have about epilepsy. Like the epilepsy walk is great, and there's a lot of education there too. But I think this is, as far as the events that I've ever been to, this is probably the most educational of all of them.
Thank you, Jason, for talking to us.
Oh, you're welcome.
It's great. Thank you.